FEAM is the Federation of European Academies of Medicine. And the members of FEAM are different academies of the medical science and also pharmaceutical sciences and veterinarian sciences. So it is very much in the spirit of FEAM to support better coordination and better cooperation across countries in Europe. So this is why this statement about the ECDC, but also about how Europe can better prepare to face the future health threats, it's very important to us. So in a nutshell, I think strengthening the work of the ECDC is important. But a key message for FEAM is also that cooperation in health research and cooperation in public health is critical for the health of citizens in the end. First is the fact that the ECDC and other agencies should be strengthened. And when the authorities are looking at how to extend the mandates of these organizations, they have to be mindful of the mandates that they are given to the organization and the resources that they are putting into this. So they need to be realistic, ambitious, yet realistic. The second point is that the European Health Union is a very ambitious plan and has many different aspects. So the ECDC is one of them, but there are plans, for instance, to create a new agency, a new authority that will take care of healthcare emergencies and that will develop medical countermeasures, HERA. And it will be very important to coordinate to ensure that these agencies don't duplicate each other or don't act in contradiction, but cooperate with each other. And the third message is very much forward-looking. There should be a wide dialogue. So in any of these proposals, there should be co-creation with the member states. So there should be dialogue between the EU and the national authorities to make sure that these changes that are implemented are realistic and are helping the authorities that need to send the data to the ECDC, for instance. As the European Commission and the European institutions are taking the lessons from COVID-19 and are trying to improve the agencies, so not only the ECDC, but also how Europe can prepare better for the next pandemic. I think there is a few aspects that can make the difference and can really improve the way in which we prepare and respond for the next health threats. And one of them is really to improve the system and the flow of information, data that comes from member states and sometimes from the regions, and that are critical for the ECDC to compile that data and to surveil and to be prepared also for emerging diseases in the future. The ECDC and the way its mandate is extended within the European Health Union will be critical, because the agency was created to support and to strengthen the way in which Europe is prepared for and can respond to infectious diseases. So in the future, if you have an ECDC that is stronger, that has resources to do better surveillance and to prepare better and to anticipate the next health threats, you will definitely have a Europe that will be better prepared.